Here we will learn the origins and insertions of the muscles that attach to the anterior pelvis and lower limb. To begin, let's define the terms muscle origin and insertion. Indicate that origin means that the bone remains stable upon muscle contraction. Then indicate that insertion means that the bone moves upon muscle contraction. In the limbs, the origin is usually proximal to the insertion. Now let's define medial and lateral on our diagram. Next, let's draw an overview of the lower extremity. Draw the pelvis, femur, knee, tibia, and fibula, and then the tarsals, metatarsals, and phalanges. In our diagram, we will draw expanded views of each of these bones in order to best see the muscle origins and insertions, but also label the origins and insertions within our overview for contextual purposes. Now draw the right side of the pelvis. First, we'll show the attachment sites of muscles that originate on the ilium from superior to inferior. Iliacus arises from the iliac fossa and joins with fibers from psoas major, a muscle that originates from the axial skeleton, to form iliopsoas. Sartorius arises from the anterior superior iliac spine, ASIS, which you can feel when you palpate your coxal bones. Rectus femoris arises from the anterior inferior iliac spine, AIIS, and the posterior superior edge of the acetabulum. Now indicate the origin of piriformis, which attaches to the anterior surface of the sacrum, and sacrotuberous ligament. Several muscles arise on the medial pelvis and margins of the obturator foramen. Working clockwise, indicate the origins of pectineus, which arises from the pectineal line of the pubis, adductor longus, which arises from the body of the pubis inferior to the pubic crest, adductor brevis and gracilis, which arise from the pubic body and inferior pubic ramus, adductor magnus, which attaches along the ischiopubic ramus and ischial tuberosity, and quadratus femoris, which arises from the ischial tuberosity. Lastly, show that obturator externus arises from the inner margin of the obturator foramen and the obturator membrane. Now draw the right femur and patella. Next, we'll indicate insertions of muscles that act on the hip. On the medial aspect of the greater trochanter, indicate the collective tendinous insertion of obturator internus, superior gemellus, and inferior gemellus. Then show that anterior to this collective insertion, piriformis inserts on the superior portion of the greater trochanter. On the lateral aspect of the greater trochanter, show where gluteus minimus inserts. Then show that iliopsoas, which comprises fibers from iliacus and psoas major, inserts on the lesser trochanter. At the distal end of the femur, show that adductor magnus inserts at the medial supracondylar line and adductor tubercle, and posteriorly on the linea aspera. Next, we'll show where muscles that extend the knee originate on the femur. First, show that vastus lateralis arises from the lateral aspect of the intertrochanteric line and inferior portion of the greater trochanter. It also arises from the posterior aspect of the femur. Then inferior to this, show that vastus intermedius arises from the anterolateral aspect of the femur. This muscle covers most of the anterior surface of the femur. Next, show that vastus medialis arises from the medial aspect of the intertrochanteric line. It also arises from the posterior aspect of the femur. Notably, these three vastus muscles insert at the patellar tendon with rectus femoris to create the quadriceps femoris. Lastly, show that articularis genius arises superior to the patellar surface of the distal femur. Genu is knee. Now draw the fibula and tibia, the bones of the lower leg, in articulation. Be sure to include the interosseous membrane, which is the connective tissue that separates the lower leg into anterior and posterior muscular compartments. Next, we'll indicate insertion sites of muscles on the lower leg. On the proximal tibia, from lateral to medial, show attachment sites of the muscles that act on the knee. The iliotibial tract, which partially encloses the tensor fasciae latae muscle, superiorly inserts at the lateral aspect of the condyle of the tibia. The quadriceps femoris inserts via the patellar ligament on the tibial tuberosity. Sartorius, gracilis, and semitendinosus insert on the medial aspect of the superior tibia. Together, these tendons are referred to as the pes anserinus, or goose's foot. Now on the head of the fibula, show the insertion of biceps femoris, which is a powerful posterior thigh muscle. Next, indicate where muscles that dorsiflex the ankle and extend the toes originate on the lower leg. First, on the anterolateral surface of the tibia, show that tibialis anterior, the largest shin muscle, arises from the lateral tibial condyle, shaft, and interosseous membrane. Then from lateral to medial on the fibula, show the smaller muscles of the lower leg. The fibularis or peroneus longus, brevis, and tertius, which arise from the fibula and are crucial for foot eversion. These muscles are lateral compartment muscles because they arise mostly laterally on the lower leg. Now show that the origin of extensor digitorum longus spans the lateral condyle of the tibia, the upper two-thirds of the medial fibula, and a small portion of the interosseous membrane. Digitorum refers to the fact that it extends to the digits, in this case the toes. Then just inferior to the belly of extensor digitorum longus, show the origin of the extensor hallucis longus, which attaches along the medial fibula and interosseous membrane. Hallucis refers to the great or big toe. Lastly, draw the dorsal surface of the bones of the foot, the tarsals, metatarsals, and phalanges. Next, indicate that digit 1, the big toe, is on the lateral side of the foot, and digit 5 is on the medial side of the foot. Now, from proximal to distal, show the insertions of muscles that act on the ankle and foot. Fibularis brevis and fibularis tertius insert on the proximal portion of metatarsal 5. Extensor digitorum longus inserts on the bases of the middle and distal phalanges of toes 2 through 5. Extensor hallucis longus inserts at the base of the distal phalanx of digit 1, also known as the big toe. This concludes our diagram.